Hello everyone, today's video is another Q&A video talking today about biofilms, heavy metal detoxification, and a side effect from intravenous ozone. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you wouldn't mind please taking a quick moment to like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. So the first question here is, okay, right. So I had a video called Biofilms, Best Disruptors and How Long They Take to Work. And someone posted a question saying, difference between phase 1 and phase 2 biofilms, where they occur. You went through the names as acronyms, not sure if some of them is DMSA the same as DMSO. So thank you for the question there, and always happy to post about biofilms. Really I think fascinating and important topic. I'll kind of rapid fire here because I have a lot of biofilm videos. So anybody wants more clarification, happy to provide that. But just feel free to keyword search on my YouTube account, and that's the easiest way to search for those past videos. So basically, phase 1 biofilm is a much less tenacious, much less sticky, much less well-established biofilm compared to a phase 2. Think of, a shower stall that hasn't been cleaned for a couple of weeks. That would be phase 1 biofilm. Shower stall that hasn't been cleaned for a couple of years, that's a phase 2 biofilm. Way harder to scrape all the goop off of the walls. Much more tenacious. They can occur pretty much any any pink fleshy tissue on the inside, so like inside the sinuses, inside the mouth, intestinal tract, in the bladder, urethra, vaginal canal, and then biofilms, to my understanding, can also form inside joints. I'm not 100% sure actually if I've seen research literature saying that they can form in the brain or not, and then they can form in the blood vessels as well. So quite a few different areas. Basically anywhere that microbes can find themselves, I guess, would be the shortest way of saying it, a biofilm can form. Now, not on the skin, I suppose, probably because there's too much friction to just get scraped off too easily. So I guess those microbes don't form that, but yeah, pretty much anywhere you find microbes, you could potentially find a biofilm would be a pretty easy mnemonic for that. So I went through different names as acronyms, not sure of some of them. So when it comes to acronyms related to biofilms, that would be with respect to phase 2 biofilm disruptors, i.e. the strongest biofilm disruptors. So some of those acronyms are DMSA, DMPS, and EDTA. Those are all chelators. They help to remove heavy metals from the body, and by binding up those metals, they also help to break down phase 2 biofilms, because to my understanding, those phase 2 biofilms have a significant heavy metal component to them. It kind of creates this like metal scaffolding in a sense, which helps to make them more tenacious. That's my understanding of it, at least. DMSA is not the same as DMSO. DMSA is dimercaptosuccinic acid, if memory serves. So that's a chelator that helps to get rid of really all the heavy metals, but particularly lead and mercury it's really good at. And then DMSO is dimethyl sulfoxide, very closely related to MSM, which I've posted other videos about. One of my favorite supplements nowadays is MSM, which is chemically almost identical. It just has an extra oxygen atom as part of its molecular structure. So very, very different. DMSA is, or DMSO has anti-inflammatory properties. It's very, very stinky. That's kind of what it's known for. When people take it internally or use it topically, it has this really kind of like oniony, garlicky kind of weird smell to it, really stinky, and totally different properties. So thank you for the questions. I'll leave that one there for now. The next one here is about intravenous ozone, posted on my video called Is Ozone Therapy Safe? And so it says, I did 5 IV ozone sessions and I did get better, but directly after I stopped sessions, I got heart symptoms, fast heartbeats, 105 at rest, quite fast, and shortness of breath. An echo scan and ECG were normal, and now I'm taking beta blockers to slow my heart rate. Why did this happen? I want to continue the sessions, but this side effect is stopping me. So thanks for the question. I'm sorry to hear about that. It sounds really unpleasant. I've never seen this in practice. I myself administered thousands and thousands of intravenous ozone treatments myself when I was running my own IVs. Then I got too busy and hired colleagues to run the treatments for me, and residents and things like that. I've overseen, under my recommendation with aforementioned colleagues and residents, many thousands more IV ozone treatments, and I've never seen that as a side effect. I teach a certification course in ozone therapy for other clinicians. I've done research reviews on ozone therapy. I've never come across that as a side effect. So it's the first I've ever heard of something like that. So I'm not. I guess I don't have anything to add except that it's not a reported side effect. So it is, if I got 5 treatments and like after my 5th one, suddenly my heart rate went up and I had all this going on, I would think to myself, this clearly caused this. But not knowing the exact details of the timeline, I'll just throw it out there that if there's any ambiguity as to whether it's like, oh, maybe something else caused it, it's just not a known side effect. I don't know. I guess kind of be like somebody saying like, I started taking, ibuprofen and I don't know, like my hand turned yellow or something like that. It's like, well, that's never ever happened before ever. It's not to say it can't happen for the first time in someone, but it's just never ever happened before. At least, again, I'm not saying I've overseen every ozone treatment that's ever been done. Many millions have been done worldwide over the years, but just it's never anything. It's not something I've ever heard of before. So it might potentially be unrelated. I'm just throwing that out there as food for thought. I hope everything gets better, and yeah, sorry I don't have more insight than that, but hopefully that's useful on some level. And then the last one here is a video I posted called Why Do Some Biofilm Disruptors Not Work? So it says here, is it important to be using 2 different heavy metal chelators at the same time? And do you need to use binders like psyllium husk to push it out? And did I hear someone say to use 2 or 3 phase 3 biofilm disruptors at the same time? I'm dealing with serious heavy metal toxicity, yeast overgrowth, and parasites. I've seen tons of this stuff come from my colon a while back, not having any idea I was dealing with parasites, but I saw them and now I'm not getting stuff out and I know more is in there and I have high amounts of lead in my body and mercury, aluminum, and cadmium. So it sounds like a lot going on. So thanks for the questions. So generally speaking, when it comes to, the question was posted on a biofilm video, so as I'm reading this out and realizing what video was posted on, I'm now a little bit confused. Generally speaking, if we're using, in my practice, if I'm using chelators to help get rid of phase 2 biofilms, I typically don't use 2 at once. I'll just use DMSA or EDTA or DMPS and not combine multiple ones. I'm not saying that wouldn't be a reasonable thing to do for some folks, but it's just not something I've ever done. Haven't really heard about anybody doing that, but it wouldn't be an unreasonable thing to do. When it comes to clearing heavy metals from the body, we routinely use a couple of heavy metal chelators at the same time. Oftentimes it's DMPS paired with EDTA in an IV, or we'll be using DMSA orally at home for certain weeks, and then the patient will come in periodically for their IVs, either just EDTA or just DMPS or both. So we kind of combine them, but it's not always necessary. It's really paired more to, or based more on what metals are elevated, because different chelators have different affinities for different metals. In terms of using psyllium to help push things out, again, that wouldn't really be related to biofilms necessarily. I mean, some might make the argument that one should use a binder or use a fiber like psyllium husk to help clear out intestinal biofilms if that's what it's being used for. I don't generally do that. I don't find it's necessary unless the patient's constipated, and we'll use different things to get them moving, and maybe that would be fiber for some folks. But that's not something that I typically recommend for my patients, but it could be, but definitely not a mandatory thing. We generally don't use fiber as part of a detox if it's a heavy metal related issue. Not that it would be contraindicated, just that that's not something I recommend for my patients as a rule, and I don't think it's something that's overly necessary. And then on the topic of phase 3 biofilm disruptors, I mean, man, oh man, I've not heard of the phase 3. So, if phase 1 is shower stall after, a couple of weeks, and phase 2 is after a couple of years, then I guess maybe phase 3 is after a couple of decades, but I'm not sure. I've never heard of phase 3 biofilm, so I might have to do some Googling later to see if I'm missing something, but I haven't heard anybody lecture about that or talk about that so far. Thanks as always for the questions. Please post any additional questions in the comment section below. I will do my best to answer as soon as I can.